HIV and AIDS can be a daunting subject matter with discussions on symptoms, prevention methods, where to get tested or treatment, and a host of other things. Who do we call for answers or counseling? Hello and welcome to this week's episode of The Last Mile with NACA. I am Adesiwa Osuni. The National Call Center for HIV and AIDS and related diseases was established to receive all your inquiries and provide you with quality information, counseling, and referral services on HIV and AIDS and other related diseases. You're watching The Last Mile with NACA. Don't go away.
Officially commissioned in 2012, the National Call Center for HIV and Related Diseases was created to support the objectives of the National Agency for the Control of AIDS, NACA, by providing information on HIV and AIDS prevention, treatment, care and support, counseling and referral services.
The National Call Center on HIV and Related Diseases is a public-private partnership initiative launched in April 2012. The call center was launched to provide confidential and personalized information, counseling and referral on HIV, AIDS and related diseases. The call center, in addition to providing information, counseling and referral services, was also set up to facilitate comprehensive knowledge on HIV and AIDS in line with the National Strategic Framework, also to facilitate sustained change in risk behavior of persons, as well as to enhance their emotional and social support. It's also to complement and strengthen behavioral change communication in line with the National HIV Prevention Intervention.
In addition, the National Call Center also handles specific issues regarding prevention of mother-to-child transmission, PMTCT, discordant couples, and gender-based violence.
As the name goes, the call center does not focus only on HIV and AIDS. Over the years, it has been able to provide services on malaria, services on tuberculosis, services on cancer, services that border on issues even of rape, issues of gender-based violence, and also Ebola, and of course, currently on COVID-19. We've had people who have called in because they've been denied access to employment, or they've been asked to move out of their accommodation because they are positive, and such cases have been brought to the attention of NACA and also brought to the attention of the different states where these issues come up, and it has been resolved. We've also had reason to interact with the National Human Rights Commission to take up on some of the issues that have come out from the call center.
There is also provision for support and encouragement for HIV test services through the counseling services offered, as well as a follow-up and feedback mechanism. The NACA National Call Center can be reached via a short code 6222 toll-free.
The call center is currently supported toll-free by 3 telcos: Airtel, 9Mobile, and MTN. The call center has the capacity to take 30 toll-free voice calls simultaneously. The Nigerian Communications Commission assigned a short code 6222 to the National Call Center to facilitate seamless and sustainable access across all the networks in the country. We are still in discussions with Glo to come on board so that subscribers on Glo can also be able to access the services in the call center. Our challenge actually is that we want to see a better coverage in terms of those who are accessing the services of the call center. Over time, we have seen more people calling from the North Central and the North West. So we are working on seeing how we can improve demand creation and then be able to attract or provide more services to those who are in the Southeast, those who are in the Northeast as well as the South.
There have been several successes recorded since the creation of the National Call Center, but NACA wants to do more.
The success stories that the call center has recorded in the area of prevention of mother-to-child transmission, in the area of referral to HIV testing services, in the area of referrals to outside, has seen, an increase in the uptake of people seeking for testing services, people seeking for treatment. And this has contributed significantly towards achieving the 1990 strategy. We're looking forward to upgrading it to an mHealth platform that has the capacity to take on more diseases and expand the capacity and the coverage and the functionality so that we can be able to expand the access to other channels, make it possible for Nigerians to be able to reach it outside voice calls, outside emails, that include Facebook Messenger, that includes WhatsApp Messenger, that includes SMS. We just want to make sure that at least more people are able to interact with the call center using social media platforms.
The National Call Center for HIV and Related Diseases of NACA plays a pivotal role in achieving HIV epidemic control by 2030. But you have to access this service for that to happen.
The call center is actually open for services between the hours of 8 a.m. to 8 p.m. on Mondays to Saturdays, except public holidays. But also to say that the technology we have supports the interactive voice response system, in which case if you call the call center outside the hours of operation, we're able to take your questions and we're able to respond once we resume for work. So I'm calling on the general public to access the services of the call center, not only for information on HIV testing and counseling, not only on information about prevention of mother-to-child transmission or sites where they can get treatment, but also on issues that border on stigma and discrimination, gender-based violence, and related diseases like malaria, tuberculosis. I encourage them to call 6222 toll-free and access quality services that is being provided by our trained agents on a daily basis from Monday to Saturdays, 8 a.m. to 8 p.m.
Help the National Call Center for HIV and Related Diseases achieve its objectives, which are in line with NACA's plans to attain epidemic control by 2030. Call 6222 today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
NACA's activities in Nigeria and elsewhere is next with our update segment. Keep watching.
Religious leaders and institutions have been a vital part of the global response to HIV and AIDS since the early days of the epidemic. However, the faith-based response to HIV must be scaled up significantly if we are to end the HIV epidemic by 2030. For this reason, the National Agency for the Control of AIDS, NACA, in collaboration with UNAIDS and PEPFAR, recently organized a national faith-based coordination meeting with the theme, Strengthening Faith-Based HIV and AIDS Response in Nigeria. The engagement aims to strengthen faith-based entities in terms of data gathering, improved service uptake, treatment literacy and adherence, as well as stigma reduction in the country. Present were representatives of the National AIDS and STI Control Program, NASCAP, UNAIDS, Nigerian Supreme Council for Islamic Affairs, Christian Association of Nigeria, among others. The event was highly interactive as several presentations were made, opinions and observations given on perceived gaps, and suggestions for the way forward. The Director General of the National Agency for the Control of AIDS, NACA, Dr. Aliyu Gambo, was present at an executive committee meeting of the Country Coordinating Mechanism CCM Nigeria of Global Fund, recently held at the Federal Ministry of Health, presided over by the Chairman and Minister, Dr. Osagie Ehanire. A country coordinating mechanism made up of representatives of all sectors is a national committee that submits funding applications to the Global Fund and oversees grants on behalf of the country. A country coordinating mechanism transparently and inclusively coordinates the development of the national request for funding, nominates the principal recipient, oversees the implementation of approved grants, approves any reprogramming requests, ensures linkages and consistency between Global Fund grants and other national health and development programs. Some participants shared more light on the role of NACA in the country coordinating mechanism.
NACA has a huge role to play this grant cycle. So the Global Fund grants are 3 years, and NACA is a PR not only for HIV for this grant, but they're also a PR for RSSH, whereas traditionally that went to a different organization. And they are also the PR for all of the COVID-19 funding. So they're managing and coordinating all of the different COVID-19 funding as well. So they have a substantial role to play.
NACA is actually a very, very critical member of the CCM. That's why you have the NACA DG, not just on the CCM, but also on the executive committee of the CCM. And beyond that, for every proposal we develop at the CCM, we're usually guided by the national policy, national plans, and NACA is the one that has provided that national policy and plans and framework that we align our proposals with to define what results we want to achieve with the resources we are bringing into the country, in line with what NACA has defined as the priority goal and objectives for the country with regards to HIV response. And beyond the technical and policy leadership and guidance from NACA, NACA is also playing a significant role in terms of managing the grants itself as a principal recipient. And you'll agree with me, it's more efficient when a government entity is managing the grant because some overhead is lower, and then it's also a lot easier to align with national systems and structures and achieve more efficiency, and you're more likely to be on the pathway to sustainability.
In a related development, a send-off ceremony was held by NACA for the outgoing country coordinator of the Presidential Emergency Plans for AIDS Relief, PEPFAR, Mark Jambrone. Expressing appreciation for the services of Global Fund and PEPFAR, the Director General, Dr. Aliyu Gambo, commended Mark for his work in Nigeria.
3 years ago, if you say today,
We'll be talking about epidemic control in Nigeria. We'll be talking about arriving at 95, 95, 95 in the next 12 months, as we see now. Nobody is going to believe you. But it's real today because of the work that has been done. So, and this is the period where Mark, was steering the affairs of PIFA program in Nigeria. So, it has been exceptionally remarkable. And we will not let this pass by without telling Mark that, look, your tenure is outstanding. Yeah, it's outstanding. We appreciate your partnership, and we want to let you know that it has changed the dynamics of HIV epidemic in Nigeria, and because of that, it has also affected the global dynamics. Because if you control HIV in Nigeria, one of the biggest tickets, globally, then you have hugely impacted the HIV control globally. So, Mark, thank you very much.
Goodwill messages were delivered by representatives of academic institutions, civil society, government agencies, non-governmental organizations, among others.
It's really been great working with you. I've enjoyed the fact that you've worked in a very open way and that you've built trust, a lot of trust. I think you've also been very engaging, and I must say you brought a lot of energy to the table. One of the things that I regret is that you will not be here to take on the next phase of the work as far as PMTCT goes. But I'm also happy that you're not going too far. So hopefully we should be able to tell you a very good story not too long from now. We're certainly going to miss you, and I want to say that you've set a standard for the person who's coming.
We in the United Nations system are very proud of your work and what PEPFAR has done, and it tells us clearly that ending AIDS requires strong, trustful partnerships. And I think you have brought a very strong leadership onto the Nigerian response, and your leadership style is leading from the front, leading by example. And the results we are all seeing is also because of the energy and passion that you've brought onto the national stage here. And we are all very proud. I stand on behalf of the United Nations system and the joint program. And as DG said, our interest is to see a world where we are ending AIDS. We have zero new infections, zero discrimination, and then also zero deaths. And I think your work is a clear demonstration of that.
I remember particularly that when Mark first arrived, he visited Akwa Ibom and saw the surge intervention going on there and gave us a few recommendations, and he has stayed with us, guiding us through all of the implementation of the surge. And we are so happy and proud with all that we have accomplished for the people of Akwa Ibom State, together and under the leadership of Mark and the PEPFAR team. We are also so delighted that Mark led the conversation with U equals U. And I remember going to the embassy with the team to make our presentation on what we were doing. And as a result of that, almost 80% of the 98% of clients that are suppressed are actually undetectable. So we are so delighted that we got that push from Mark.
In his response, Mark Jambrone thanked NACA for the gesture.
I'm quite close with a lot of the other coordinators I work with in not all 52 countries, but a majority of them, because we can commiserate together and we can, pass back best practices and learn from each other. And I will say that the one common denominator that everyone, and I can honestly say every single other coordinator, is envious of me, is because I have an amazing and transparent and honest relationship with the government of Nigeria. I don't think it's true. I don't think we realize, because our work is here, but outside of Nigeria, it's very challenging for a PEPFAR team to work without the support and partnership of the government in which we work. And I can't think of a better partnership since I've been here as PEPFAR coordinator than with the DG and Dr. Akudo. I think that the reason why we have been able to accomplish what we've been able to accomplish is because of them. So as a NACA institution, thank you for all that you do, so thank you.
Highlight of the ceremony was the presentation of gifts and cutting of cake. Mark Jambrone became PEPFAR Country Coordinator, Nigeria, on August of 2019.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols. Wear a face mask and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
This HIV self-test kit has been certified safe and effective by the WHO, Federal Ministry of Health and NACA. For more inquiries, call the NACA Information Center free of charge on 6222. Do not eat, drink or use mouth cleaning products 30 minutes before the test. Find somewhere private with good light and a flat surface. The kit includes instruction leaflets that should be read carefully, a test stand and a sealed package containing a test device, developer tube and preservative used for storage only. This is not needed for the test. Open the test tube and place it in the test stand. Grab the test device by the handle. Do not touch the flat pad. Apply moderate pressure while swabbing the flat pad once along your upper gum and once along the lower gum. Immediately put the test device in the developer tube. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Test is positive if both control and test lines appear, in which case you should contact NACA Information Center as soon as possible for advice on the next step. Test is negative if only control line appears. Test is invalid if there are no lines or only test line appear or the white result background becomes red and should be repeated. Properly dispose all contents in the normal trash. Support NACA and the fight against HIV. Know your HIV status today.
We urge you to take advantage of NACA's world-class call center for quality information and services on HIV and AIDS and related diseases, available 24 hours all week. As always, thank you for watching and please continue to support the HIV response. Avoid indiscriminate sex. Do not stigmatize or discriminate people living with HIV. And lastly, know your status and take action. Till next week on The Last Mile of NACA, I'm Adesi Wellesley. Goodbye.